Okay, a couple more things from our opening section here is social neglect is a both a requirement and what I would say to you is a driving force, psychological force or social force in the reactive attachment and disinhibited social engagement disorder we're going to talk about. Um, and I noted as I was reading this myself that while in a perhaps in a broader, more general practice or working in a hospital, you might not see these conditions terribly often. Other settings, such as a child protective service type of setting, you may see that quite a bit. So I wanted to just call that out. And then, secondly, and of course, this relates to the prolonged grief disorder that grief, despair, and dysphoria, and even sort of in terms of your client presentation to you, like looks significant, still can be part of a normal grieving process. Now, the one thing I wanted to, as versus, you know, the the prolonged grief disorder itself as a diagnosis. Um, in terms of providing clinical work and how do you build clinical work when someone's having really needs support in their grief, which oftentimes people do, that where in which it doesn't necessarily meet criteria for prolonged grief disorder um, or another diagnosis. The, in my opinion, the best diagnosis to go to is adjustment disorder. It's a little bit of a misnomer because, well, someone you lose a parent or spouse to death, um, and you say, well, of course they're not adjusting well to that. Why would they? Right? Absolutely. So the term adjustment disorder is not my favorite, but I think it can be a place you can go to diagnostically if you're like, okay, I don't, this is not meeting criteria for prolonged grief disorder, but I want to make sure that I'm, from an operational standpoint, like providing clinical justification, like this person needs professional support. They want it, and I want to provide it, and I think it's proper and efficacious. I think from a diagnostic standpoint, adjustment disorder can help can fit the bill there, so to speak. The only other thing I wanted to the other thing I wanted to call out to you. So when we look at prolonged grief disorder, it's going to talk about death of a loved one. When we talk about grief, it's often um, involves loss due to death. But I would tell you that I see a lot of grief and significant grief um, that where the individual, clearly can benefit from at least therapy, in terms of professional support. Does not have to be loss from death. Now, I'll give you another example of this that's again going on a good bit at the time of this recording. So, take for example a person who lives in like in a tornado alley in the Midwest, in the southeast Midwest area, and there's a tornado, and everyone survived, but their home is destroyed, and they're not 100% sure because of broader macro circumstances if they're going to get either the private insurance support or the federal government support to rebuild their home. And either way, even if their home does get rebuilt, they're looking at a pile of rubble that used to be their home. Or that thing, what else has gone on, in recent times, at the time of this recording, is losing the house to fire and their home is a pile of ash. It might get rebuilt, it might not. But that can be a significant loss, even though it's not loss to a death. Like everyone in that family unit or in that neighborhood is safe, no one died, but their homes are destroyed, and they're literally looking at a pile of rubble or ash that used to be their home. That can cause a significant grief. Just as an example, so I just wanted to just again, that's not spelled out in the book. That's just for me, for your own consideration. That significant grief can come from losses that are not just due to death. Okay, so that's it. And then we're going to go on from here into some of the specific diagnoses in this section.